Hello, everyone. Welcome to the National Consultation on the Impact of Climate Change and Human Health in Nigeria, a pre-COP26 consultation between relevant stakeholders.
Mr. John, sorry, let me cut it short. Sorry. I know we have to start 6 on the dot. Some people are still coming in. Let's just give them about another 5 minutes. Another 5 minutes. I apologize. People are still signing in. I hope they're not having issues. But just at 18:05, we can start off.
Okay.
Yeah,
for those who are coming in early, thank you for coming in early, and we appreciate. Let's give some of our colleagues that might be having challenges to join in a little extra time, and hopefully we'll start by 6:05.
Thank you very much. I'm going to send you the speech to be read by for Dr. Lewison. When they call her, you read the speech, okay?
All right, sir.
All right. All right.
making out time to be here. And I hope you not waste today, get more information about climate change. Thank you for being around.
You're welcome, sir. And thank you for agreeing to co-host this event with me. And I would like to present the chief host of this event, Pastor Peter Omaragbon, who would introduce himself, and thereafter he would give his opening remarks. Pastor Omaragbon, the floor is yours.
Thank you very much, Mr. John Ede. Once again, I see this opportunity to apologize to everyone here for the slight technical hitch, but I want to equally appreciate your time and your efforts to have joined us in this epoch-making event. Today, we're having the first National Consultative Summit on the impact of climate change on human health. And I will just give a brief welcome remark so I can give the floor to our speakers and our partner organizations representatives that are here present. Yesterday, October 11, 2021, the World Health Organization launched its COP26 special report on climate change and health in the lead up to the UNFCCC Climate Change Conference, that is COP26, coming up in Glasgow, Scotland, in less than 3 weeks from now, spelling out the health community prescription for climate action based on a growing body of research that establishes the many and inseparable links between health and climate change. In the report, the WHO laid out 10 agenda action points that must be implemented by governments, business communities, and the civil society, which calls for climate action to assure a sustained recovery from COVID-19. Today, nurses across the borders, in collaboration with the Senate Committee on Ecology and Climate Change, the Nigerian Nurses Charitable Association, United Kingdom, Ikosi-Ejirin Local Government Development Authority, SeaTrust Institute USA, and the Civil Society Network on Climate Change in Nigeria are equally launching the first in the series of a national summit on the impacts of climate change on human health. Our primary objective is to galvanize all health care professionals in Nigeria in leading these efforts because of their roles in not only saving lives from any climate change disasters, but also to sustain lives by way of building capacity of the members of the community on strategies to mitigating the effects of climate change. It is a known fact that 95% of the causes of climate change are by human activities and our lifestyles. And who is better placed to reinforce the preventive education of the community other than the healthcare professionals who are with the people 24/7 in the hospitals due to the adverse effects of climate change on their health. Nurses Across the Borders, as the first NGO from Nigeria to be admitted into the UNFCCC forum as an observer organization from Nigeria, in 2004, also initiated a campaign to link health and climate change in Nigeria in 2010 at the Lagos University Hospital, Nigeria, in collaboration with WHO, Ikosi-Ejirin Local Government Development Authority, and the LUT branch of NAM, with the capacity building that introduced nurses and other healthcare professionals to their roles in this regard. The same year, at the UNFCCC COP16 in Mexico, Nurses Across the Border launched the global campaign for health to drive the climate change campaign in collaboration with WHO, SeaTrust Institute USA. And in 2011, at Durban, South Africa, we launched the Global First Responders to Climate Change Disasters and Risk Reduction. The same campaign was taken to Rio, Brazil in 2012. That was at the 20th anniversary of the UN Sustainable Goals anniversary. And at that same event, we were the only NGO from the country that had a side event to promote a campaign on the linkage between health and climate change. This campaign was taken to the UN Conference on Disaster Risk Reduction pre-comp in Geneva in 2014. And in 2015, we were the only Nigerian NGO that had a side event at the third UN World Disaster Risk Reduction Conference held in Sendai, Japan. All these were efforts to galvanize and coalesce support for the central role played by Earth and its professionals in any disaster and risk reduction in climate change campaign. By the way, what better way to measure the success of any climate change campaign if it is not to assess its impact on human health? And that is why the WHO director yesterday said that the COVID-19 pandemic has shown a light on the intimate and delicate links between humans, animals, and our environment. Wherever we deliver care in our hospitals, clinics, and community around the world, we are already responding to the health harms caused by climate change. Right now, compared to other nations of the world, Nigeria, as the most populated nation in Africa, is yet to fully recognize, appreciate, and support in building the capacity of our healthcare professionals by allowing them to drive the process of the climate change campaign. That is why we are having this summit to address these issues and provide workable solutions which tallies with the WHO 10 action items mentioned above earlier. For the record, permit me to list the WHO 10 action points that were launched yesterday. The number one, it says committing to a healthy recovery. That means we are to commit to a healthy brain and just recovery from COVID-19. The second goal was our health is non-negotiable. That means we should place health and social justice at the heart of the UN climate talks. 3, harness the benefits of climate action by prioritizing those climate interventions with the largest health, social, and economic gains. Build health resilience to climate change by building climate resilient and environmentally sustained health system and facilities, and support health adaptation and resilience across sectors. 5, create energy systems that protect and improve climate and health. That is, guiding a just and inclusive transition to renewable energy to save lives from air pollution, particularly from coal combustion, end energy poverty, and household and healthcare facilities. Permit me to digress a little. Those of us who are used to the Nigerian system, or even most African countries, because of our lack of energy supply, what institutions like the hospitals rely on for their supply is fossil fuel to power their generators. You go to any hospitals today, you have generators pumping carbon dioxide from the fossil fuel that is used by the generator. And you have patients, the air within the hospital environment are polluted, and you don't have clean air. And the patients who come to the hospital for treatment may end up going back home with a separate disease condition entirely. Number 6, reimagine urban environments, transport and mobility by promoting sustainable, healthy urban design and transport system with improved land use, access to green and blue public space, and priority for walking, cycling, and public transport. And so most countries like the United Kingdom, they are working towards green energy, and the focus is within the next 20 years, vehicles that rely on fossil fuel or diesel will be phased out of the system. And then what would not be used will be vehicles that will be powered by other form of energy or what have you. Number 7, protect and restore nature as the foundation of our health. What way can we do this? By engaging in planting trees, by making sure that, yes, you have little gardens in your compound. You have that fine house, create a garden, because the essence of those plants you have in your compound is to help absorb the emission of carbon dioxide in the atmosphere. And so within the environment, you begin to breathe in clean air. Number 8, promote healthy, sustainable, and resilient food systems by promoting sustainable and resilient food production that are more affordable, nutritious diet that deliver on both climate and health outcomes. 9, finance a healthier, fairer, and greener future to save lives. Last but not the least is listening to the health community and prescribe urgent climate action. Mobilize and support the health community on climate action. It was based on item 10 above that Nurses Across the Borders is a signatory to the open letter titled Healthy Climate Prescription, with 300 organizations representing about 45 million nurses, doctors, and other health workers worldwide. The open letter is going to be delivered to all heads of government in Glasgow 26. That is a petition by all the major stakeholders within the Global Health Alliance, asking the government to take action. And so at that same COP26 in Glasgow, Nurses Across the Border is also presenting a side event, and the theme of our side event is capacity building for healthcare providers and environmentalists, advocating for ecological action and land restoration for health, for climate action and improved health in Nigeria. In conclusion, we cannot be prouder than being able to bring together the crop of the distinguished speakers today, who will be providing deep insights into the theme of our summit. Permit me, therefore, to recognize in no particular order our guest speakers. I just want to mention them, but when it is time for them to make their presentation, we'll give a brief about their biodata. We're going to have in our midst Dr. Mrs. Osikan George Emana, who is from the Goethe University in Frankfurt, Germany. She will be talking on the role of the private sector in financing climate change in Nigeria. We're also having Mrs. Tenny Badekodumi, who is the Executive Director of Ecology Nigeria Limited. She will be talking on COVID and climate change, its impact and responses. Alhaji Dr. Abubakar Umar Farouk, the General Secretary and Registrar of the National Scientific Council, will be making an intervention on the health implication of climate change and strategies to mitigate its impact, the role for the nurse and midwife. But he is going to be represented by Dr. Dorothy Ore, one of the departmental heads at the National Scientific Council in Nigeria. We have also in our midst Dr. Awe Olufumilayo. She's a medical doctor, a statistician, and an epidemiologist who will be giving us an insight on climate change, the disproportionate effect on women's health in Nigeria. The last but not the least will be Ambassador Odinaka Kisley Obeta, a medical laboratory scientist. He's going to let us know what the impact of climate change are on social and environmental determinants of health, and how it is resulting to poor health outcomes and increased mortality. Ladies and gentlemen, ladies and gentlemen and colleagues, I want to thank you all for creating time to be a part of this solution and not the problem to this global challenge. I also want to express the apology sent by the distinguished Senator Mohammed Hassan Gusau, the chairman of the Senate Committee on Ecology and Climate Change, who is right now in transit because he was in Italy the whole of last week, up until this week, for the EEC Climate Summit as a pre-COP summit to Glasgow 26. And so, once again, I thank you all and I wish you all happy listening. God bless you.
Thank you, Pastor Peter Omarogbon, for the interesting insight shared so far. Moving forward, I would appreciate to give the floor to Princess Wendy Olayiwola Odutola. Forgive me if I didn't call that name well, but Princess Wendy is the president, Nigerian Nurses Charitable Association in the United Kingdom. The floor is yours, Princess Wendy.
Hello, everyone. Yes, you did pronounce my name very well, John. Thank you very much. A
Thank you.
very good evening, everyone, and it's quite nice to be here today to support our colleagues and obviously to work collaboratively together in this important change. And I do bring greetings from all the Nigerian Nurses Association UK executives and the members. And we're so glad to be here today. I'm sure we should have quite a few of our members joining us this evening. What can I say? I think Pastor Peter has really summarized it all in terms of the reason why we're here and the importance of this evening. I'm just going to mention, it's quite important. I'm going to give a bit brief of what it is and the importance of it, as well as showcase. I'm so very proud to showcase what UK, especially the midwifery workforce, is doing within the climate change. So it's important. Before I go, that would be the last thing that I will say because it's a good news. So I'm going to leave the bits of good news behind, at the back or at the end of my little 3-minute speech. So it's important to say that climate change affects all of us, and the most severe impacts are being felt by the most vulnerable people. As we know that vulnerable people, are being affected by many things. So existing inequalities exacerbate the risks to people's life and the livelihoods. So inequity also affect people's capacity and opportunity to participate in the transition to a green economy. So basically, climate change is very, very important, even within our professions. So as nurses and midwives, and nurses being the most trusted healthcare professionals, we are really in a unique position to inform and mobilize the society to act in climate change. So as the nation's, most trusted professionals, again, in any part of the world, nurses can also lead the charge to significantly improve society's response to climate change. So I'm really charging, my colleagues online today to make sure that we actually, improve and we advocate for climate change and foster the strategies that is needed for a healthy future for everyone. So how do we join on in this journey? How do we embark on this journey? How do we join nurses across the borders, to achieve this aim? So we need to ask nurses and other colleagues, midwives, health visitors, doctors, everyone within the healthcare system to join in advocacy. We should promote best practices that benefit the environment and make sure we share the success stories. I'm sure there are lots in there, and I shall be sharing one with you shortly. And we should take on the leadership role in our organizations, as Pastor Peter is doing today, to encourage decreased energy, as required. So, what is the good news that I would love to share with you today? So, this is it. So, climate change presents, and this is a quote that I'm using from our the first chief midwifery officer of England, Chief Professor Jackie Dunkley Bent. Climate change presents a major threat to our patients, our women, and communities. 1 year on from becoming the world's first health service, and that is the NHS here in England, to commit to reaching net zero, NHS midwives are now playing a crucial role in delivering this vision. So the good news there is midwives at the Newcastle hospitals here in UK have delivered the first UK baby using a climate-friendly gas and hair machine. So for those that do not know, um, for those that works in the maternity, you do know that mothers, when we go into labor, they have different form of pain relief, and gas and hair is one of the pain relief that a woman will require, or at the least have gas and hair during labor. So we have a baby that's been delivered with a climate change friendly gas and hair, and that is really a breakthrough. And we are all shouting about it. So it's doable. I just want to implore everyone to come on board and let's advocate for climate change. Thank you very much.
Wow. Wow.
Thank you, Princess Wendy, for such, I would say, very deep insight into what is happening, and we appreciate you sharing this. I would call on my co-host, Gino, to introduce our next partner organization. Gino, please.
No, Gino will be reading the speech from our youth. Gino, you are mute. You are muted.
Yes, sir.
Okay. Yeah, you'll be reading the speech by Dr. Linwisi, who is our international and the executive director for SeaTrust Institute USA.
Yeah, I have it already.
Okay.
Hi everyone, once again. My name is Gino, and I'll be reading Dr. Lynn Wilson's speech, and I begin. Hello, and thank you for your kind invitation to address the Consultative Forum on the impact of climate change and health in Nigeria. I regret that I'm unable to attend in person, so I send this message in support of your conference and ongoing work. I have known and worked with Pastor Peter Maragbon and nurses across the border for over a decade on ways to integrate human health into the global conversation and decision about climate change. As collaborators, the global South and North, as collaborators across the global South and North, it's my privilege to help navigate our diplomatic work on health, and especially the critical roles of nurses in providing not only health services, but in bringing the education and knowledge of communities to develop resilience to the effect of climate change. Global decisions and discussions translate into local actions. In Nigeria, the situation has been critical and is escalating as climate disasters increases, particularly in communities with limited services or civil unrest that create even more difficult situations for frontline health workers. Never has there been a more critical time for nurses to lead communities, not only in recovery, but in building resilience for times to come. Our world is on the road to devastating effects from increasing climate change disasters. According to the reports,
we're having I think there's a hello, I think we're having Gino is frozen there. All right. Permit me to just to complete it. I think Gino is having issue with his network. Global decisions and discussions translate to local actions. In Nigeria, the situation has been critical and is escalating as climate disasters increase, particularly in communities with limited services or civil unrest that create even more difficult situations for frontline health workers. Never has there been a more critical time for nurses to lead communities, not only in recovery, but in building resilience for the times to come. Our world is on a road to the devastating effects from increasing climate change disasters, according to the upcoming to the IPCC AROC report, and from the empirical evidence all around us. The IPCC is more prescriptive for policy action and community response than previous scientific reports, and for good reasons. We are at a critical juncture that requires us all, global North and South, to work together to build our respective and share resources ethically towards the goal of human health and well-being as a key to resilience. We need creative approaches that engage all sectors, public and private, in that quest. That those should come from the health sector is unsurprising. With the issues exacerbated by the global pandemic, the role of nurses and other frontline health professionals has never been more evident. I commend and support your efforts and know that you will be leaders in finding the most humane, efficient, and effective ways forward in the ongoing climate crisis as well. I wish you a productive and creative conference and hope to see those of you who will attend COP26 in person in Glasgow. Kind regards, Dr. Lynn Wilson, Executive Director and CEO, SeaTrust Institute. John, over to you.
Thank you. At this junction, having taken some of the opening remarks by our supporters, our partner organizations, we want to dive into the discussion proper now. We were expecting Honorable Okogun Wale Raji, and we are hoping that he can still join in. But until that happens, is the executive chairman of Ikosi-Ejirin Local Council Development Authority in Lagos. We are hoping, I'm sure, for political reasons and some engagement he's having.
Wow. I want to believe the unstable network in Nigeria is making things a bit difficult for our participants from Nigeria. Why that is ongoing, I think you will permit me. John, are you back? Wow. You're going to permit me.
I was going to blame
climate
change for my frozen network.
Sorry, go on. Thank you very much.
So we would provide a summary of that, hopefully at the end of the event. But before we start, let me emphasize, it's a short session, running only just about an hour left. So I will need to moderate the presentation. Please, we know that our presenters will not go overboard. So I advise you at forehand, will not interrupt rudely. But so without further ado, I will now introduce our speaker. First, I would introduce, okay, it's actually a challenge for me to decide who to, but let me go ahead with
Mrs. Tenny, yeah.
Dumi, Executive Director, Ecology Nigerian Limited, who will be discussing on COVID and climate change, its impact and response. Mrs. Tenny, if you can hear me, please, the floor is yours.
Okay, good evening, everybody. Can you hear me?
Yes.
Loudly?
Yes.
Great, fantastic.
Yes, sorry, Mrs. Can I just interject quickly? Before Madam Tenny gives her presentation, let me just say, Tenny Madekodumi is a lawyer whose early career started out with multinational organizations and formal law practice. After several years of being a successful practitioner, she ventured out into specialized areas, becoming a climate change expert and international trade consultant with first-hand experience in digital trade access to U.S. markets, the FCTA. Furthermore, in 2009, she added entrepreneur to her repertoire, putting her master's degree in carbon credits emission reduction to use by attaining an advisory role to the government and UN community in formulating new policies, eventually leading negotiations for Nigeria at the UNFCCC COP meeting 2009 to 2013. In 2012, she started a social impact enterprise, beginning as a cottage industry, which has now grown to an award-winning social enterprise, exporting to 3 continents. This recently led to her appointment as a national expert consultant by the UN, where she has thus far exceeded goals set by the UN, coaching and mentoring over 500 women to access international trade markets. She is happily married with 3 children. Mrs. Madekodumi, the floor is yours.
Thank you very much, Pastor Peters. It's been so nice to be in this company and to be able to converse with everybody. I also want to just say good evening to everybody as well. And it's nice to be in this community. I'll just want to start now by sharing my screen. And because of the network info, just forgive me, I'd have to turn off my video just so that the network bandwidth doesn't get interrupted. sharing the screen now. Great. So my topic, as Mr. John had mentioned, is impact of climate change, COVID-19 and climate change, its impacts and responses. My business is called Ikosi-Ejirin, and we are a consultancy, legal and environmental consultancy registered in Nigeria. And our areas of expertise is carbon credits, capacity building, and fossil fuels for renewable energy. To begin, COVID-19 and climate change, its impact and its responses. Everybody has just been talking about COVID from one end, but no one has actually gone to think about the other side and how much important people have now started taking climate change to be since COVID came about. And we all know how much havoc COVID, the pandemic, evoked on all of our countries across the globe and all the economies that have slowed down. However, the outbreak has also impacted the environment in an intriguing and, reminding us that we need to put nature first. And this is not a better time, It's like, as the COP slogan for COP26 goes, build back better. This is just, that's why when Pastor P mentioned that he was doing this, I thought this is fantastic because there's no other time to talk about this than now. So this is really the time we need to catch up. And the pandemic has, in a way, helped to make this happen. But, as the pandemic has now spread in different parts of the world, its consequences have now run farther than the closed borders, of course, the scarce hand sanitizer, social distancing protocols. But, recent polls have conducted by the IMF found that 43% of people surveyed reported being more worried about climate change now than they were before the pandemic, which goes on to what I just mentioned, a few minutes ago about how it's becoming more important we have no choice. And COVID-19 is affecting the lives of millions of people, but also the environment. The heightened public awareness, around the dangers of the unmitigated climate change makes it an important moment for policymakers to enact bold reforms. And in the long term, COVID-19 will offer lessons and opportunities leading to environmental action. And for instance, we'll have a baseline of what can be achieved digitally, be it remote work, education, shopping, and much more. But then if you now go back to, let's look at it, climate change, we've all known this, Kofi Annan mentioned this in 2006. It's not just an environmental issue, as too many people still believe it's, it's an all-encompassing threat. And the pictures in this, in the slide shows the first one, contributing to the worsening of what climate change will do. It will contribute to the worsening of the air quality. We heard that earlier on as two other speakers spoke about that on this session. How it has different impacts around the globe. The red sections of this second picture in here, I don't know if you can see my mouse, but in there, it will show the areas where the temperature is changing the greatest. Unfortunately, this picture is not very clear, but the next slide will show it better. And, the results in displacement is getting worse. This was in 2006. This third picture of this child in here shows displacement. People are losing their homes. And then, of course, the fourth picture highlights the impact of climate change on the world's supply of fresh water. And some experts have theorized that the health effects of climate change in the world, in the developing world, may be mediated by water. This means that the health impact of the shortage of drinking water and irrigation for crops may have been greater than any other effect of climate change. Now, looking at all these four pictures, one thing that comes to mind is we have, since 2006 to now, we have witnessed all of these four things. These catastrophes have all been witnessed, from the bushfires in New Zealand to the different parts of the US, to all the land issues that are going on in different parts of, even in Nigeria, we're seeing it. So it's clear that it's getting worse and worse from when we first started, in fact, from 50 years ago. Now, I'll just go in to talk a little bit about some of the most common questions. Let's review these questions in relation to the environment and coronavirus. Does climate change affect the transmission of coronavirus? There's no direct evidence that climate change is influencing the spread of COVID-19, but it's known that the climate change alters how we relate to other species on Earth and other matters to our health and our risks for infections. So as the planet heats up, animals big and small, on land and in the sea, are headed to the poles to get out of the heat. That means animals are coming in to contract with other animals that they normally wouldn't, and that creates an opportunity for the pathogens to get into new hosts. Many of the root causes of climate change also increase the risk of pandemics, deforestation, which mostly occurs for agricultural purposes, is the largest cause of habitat loss worldwide. But loss of habitat forces animals to migrate and potentially contract other animals, and people share germs. We may have many reasons to take climate action to improve our health and reducing risks for infectious diseases. Emergence is one of them. And going back to what started coronavirus, everyone kind of heard it was this bat issue from China. And it's similar to what is going on, what we just discussed, what I just mentioned now, sharing of animals having to move and migration of animals is causing pandemics to increase. So these are things that we all must not overlook, and we must fail not to overlook, but fail to put into consideration when we're trying to combat topical issues like climate change. So going back to the hard facts, I'm so happy to be able to find some new slides to put together. You can see it in here, this first slide, the deaths that have occurred from climate change. And the darker ones are bigger than the other ones, which makes you think about the social injustice of this whole issue. Because the people that have not contributed to the effects of climate change are the ones that are suffering the most. And if you look at this graph, you see the darker pictures, they're all in Africa. And we are the ones that have had the most deaths from climate change. Going on to the second picture, predicted effects of climate change, 73 plus deaths per 100,000. Projected increased annual death, and this is by temperatures will be rising by 2100. Hot and poor countries, such as those pictured above, will be disproportionately affected. You can see in here which countries they are. According to statistics, between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year from malnutrition, malaria, diarrhea, and heat stress. The direct damage costs to health is estimated to be between the billions, 2.4 billion, $2 to $4 billion by 2030, according to the World Health Organization. And areas with weak health infrastructure, mostly in developing countries, will be the least able to cope without assistance to prepare and respond, according to the World Health Organization, which then goes on to now say the importance, or highlight the importance of why nurses and the medical sector are so ingrained in the effects of climate change, need to literally work hand in hand in order for us to be able to see some kind of mitigating effect. And forums like what Pastor Peters is putting together is remarkable because it has been going on for a long time. I remember the last time I spoke at his panel, that was in 2010, I think, or 2013. And it's great to see that the fervor and intensity is still there, but it shows that we mustn't let pandemics, we mustn't even allow for another pandemic to come because we are already disproportionately placed because of where we are geographically. And so how likely are we to see infectious diseases spread as a result of climate change? And will warmer weather slow down the spread of coronavirus? No, there's no sense of what the changing weather will mean for COVID-19. And so it shouldn't be relied on for warmer weather to curtail transmissions. We need everything we can right now to slow down the spread of this disease. And that means we need to follow the advice that public experts are telling, practice social distancing, good hygiene, among other actions. And why is it so important for health officials to talk about climate change now? Just as I mentioned earlier, if we really care about preventing this kind of problem in the future, we need to think hard about our climate change and the biodiversity crisis. There is no better time as now to talk about the broader issues that we face, as we simply cannot deal with crises like this pandemic with another climate-related crisis, because when we absolutely know how to implement climate solutions and can put them into action right now. So it's clear that we need to put all these actions into play immediately for us to be able to protect and preserve the future. So, going back then, a lot of people then ask me, then what would you say, what kind of actions can we then can we take to prevent future outbreaks? And, we've mentioned some before, but some would be, we can make smarter investments, even as a nation, as a whole, to avert another outbreak. Federal, state, and local governments need to support public health leadership and science so that we can provide more funding for needed research, as well as early response to outbreaks and supplies for testing. And we can do a lot more to control the illegal wildlife trade, because that's pretty much what started a lot of the challenges of COVID. Anyway, and so the benefits of aligning responses to COVID-19 and climate change. Aligning responses also offers a chance to protect the planet's biodiversity and limit further changes to diverse ecosystems. Through strategic adjustments, of course, further loss of life can be stopped, and more implementations to amend human behavior so that it has less impact on the environment. And as written on the slides there, experts have proposed that aligning government responses to pandemic and climate change would allow for overall improvement in public health. And I think that's something that must not be avoided or put to later. It needs to be taken immediately. And so this is my last slide. Similarities between COVID-19 and climate change. Both crises have pushed the regional and global healthcare systems around the world to the limit. And climate change and COVID-19 have resulted in large numbers of people being hospitalized, forcing countries to reassess how they manage their healthcare systems. An international team of scientists from institutions in the UK, Germany, and the US were able to link the climatic changes that occur as a result of climate change directly to COVID-19. And they emphasize that the number of bat species present is linked with the number of coronaviruses in a particular environment. And once we are able to see things like this, it's clear that we need to start taking the action now. So to wrap up, I would pretty much just like to reiterate what I'll end with what Pastor Peters had mentioned about how we need to start. It starts from you, and something as simple as planting trees around your environment, planting a little, having a little plant around you, just so that you can start to preserve and keep the future for our future generations, is something that we need to just start taking a lot more seriously. And it's not only for the roadmap to Glasgow or to whenever there's a COP. We need to do this all year round and to remember to always do that. And that's where I will stop for me. I'll stop there. Thank you, everyone.
Thank you. Thank you. And thank you very much, Mrs. Tenny. Quite appreciated how calmly you were able to share this very insightful thought and a call for action. I didn't see any question coming in the chat box, so I would move on to the next speaker. and I would be introducing yes, I will be introducing Dr. Mrs. Insikan George Emanan from
let Usika will be giving paper last.
Okay.
I think the registrar is supposed to be giving his. He has I want to find out if. Hello. Is Dr. Dorothy here, please? If we are chatting, she's trying to log in. I don't know why she's having issues logging in. While we are at that, may I just maybe throw the floor open, because Usika will be giving our paper last, and let's just take one or two contributions from any member of the floor, or any question while we try and sort out the technical issue with Dr. Dorothy presenting the. Everybody, you have the floor. Feel free to contribute or ask any question you feel like you want to ask at this point in time, please. I'm multitasking here. I'm trying to ask Dr. Usika to join us, because at this point in time for COP, she's busy with series of meetings, because they are the headquarters of the Climate Change Secretariat in Bonn. So I'm just calling her to join us.
Maybe while we wait for Dr. Nsika, we can proceed to the next speaker. We could have Dr. Awefu Olua Fumilayo.
Yes.
To make
you're
a
right.
present.
That's true. Okay, that's okay. That's okay.
Okay. Please, when you are not speaking, it will be helpful to leave your mic on mute before any intervention. And at this point, I would like to give the floor to one very respected climate change activist and lab scientist, Ambassador Odinaka Kingsley Obeta, who is a medical lab scientist and a public health practitioner with very strong interest in malaria programming. Currently, he is a certified climate reality trained leader, and Odinaka is also a malaria youth champion with Malaria No More UK, and also a zero malaria champion advocating for free, for malaria-free Africa. He is currently a member of the 11-man Youth Advisory Council of the African Leaders Malaria Alliance under the leadership of His Excellency, the President Uhuru Kenyatta of Kenya, where he works with other members of the council. He is also in the Jos University Teaching Hospital in the medical lab unit. At this point, I want to introduce and hand over the floor to Ambassador Odinaka Kingsley Obeta.
Okay, thank you so much, John. Thank you so much. A very warm evening to everyone. It's such a pleasure and such an honor to be here and to also be a part of this consultative forum. And I must really commend the commitment of the nurses across border, in regards to taking action against climate change and engaging health professionals, such as the wonderful and amazing nurses we have across the world. the fight against climate change. So I am actually having some issues with my network, and I wouldn't want to be speaking in and out. I don't know if you all can hear me. I am requesting to turn off my video, so I'll be using a slide here. John, I don't know if you're there.
Please go ahead.
Okay.
You can.
I am turning off the video.
Please go ahead.
Okay. Yeah. So climate change is, so it has become a defining issue, in the 21st century, and alongside issues around air pollution, climate change at the moment constitutes one of the top 10 threats, global health as of 2019, as expressed by the World Health Assembly. And at the moment, we have seen a lot of issues, coming around climate change. I want to first start by saying that it would be shocking to believe that a lot of health professionals or practitioners, don't have a good opinion about the relationship between climate change and health. And it is important that this meeting, is having health professionals across different angles together to discuss it. Now, the World Health Organization estimate that direct damage cost of climate change on health is around $2 to $4 billion per year, and it will be rising to that extent around 2030. And this is excluding the cost in health determining sectors such as agriculture, water and sanitation, amongst others. And it's becoming a case of concern because aside affecting the health and well-being of citizens, of people living across the world, climate change is also affecting our economy, is also affecting every aspect of life, hence why it's an issue of concern, and hence why it is also one of the top 10 threats to global health at the moment. I'll be making a lot of emphasis on the social and environmental health, and I'll just be highlighting a few because of our time, and I just hope that we'll follow soonly. Now, social and environmental determinants of health are more like the full set of social and physical conditions in which people live and work, including the social, economic, demographic, environmental, cultural factors, along with the health system. And some of the major social determinants that would be forming heart of our conversation today is issues around safe drinking water, quality air, food security and nutrition, disease vectors, and secure shelter. Mrs. Tenny, in the course of our presentation, was talking about a lot of the challenges we've seen with the fire, with fire outbreaks. We've seen issues around even the COVID-19. All these challenges are issues that are hitting up the world at the moment. And it's quite unfortunate to see that they all have input, in climate change. Now, climate change and drinking water alongside with sanitation. We have about 70% of the population in sub-Saharan Africa relying on drinking water sources such as boreholes and improved well. Right now, under climatic stress, water infrastructure can be damaged and surface water polluted. This can lead to water scarcity, increased competition for water resources, disruption of waterborne sanitation systems, contamination of this water that is already scarce, and hence leading to spread of disease such as cholera, typhoid, and shigellosis, amongst a lot of others. And we have about 7 in 10, of the 150 million people depending on water, taking directly from rivers, lakes, and other sources, other surface water. We have this 159 million people living in sub-Saharan Africa. Now, I live in Jos, Plateau State, Nigeria, and one of the major issues we have seen over the period of time now is the issue of safe and quality water. We do a lot of work in the communities, economically deprived communities here in Jos. One key thing we realize is issues around accessing quality and safety water. There was this community we had to work, and these people, because of their inability, because of the nature of the terrain, they have to access water from river, and you could see children fetching water from this river with, fetching this water with such excitement that they are getting fresh water. Meanwhile, the water they are getting is highly contaminated and they have no idea on even how to go about treatment and all that. Now, aside the fact that we're having contamination on our water, we're also having scarcity as a result of climatic threat that's happening to the soil. This is a challenge. Now, we paid little or no attention to how much of an impact this is causing because we don't see the direct relationship between climate change and health. With some of these facts that is coming up now, we're beginning to realize that climate change is a business that affects every single person on the earth. It's not an issue that climate activists alone should be fighting against. It's not an issue that that should be discussed only in consultative forums. It should become a day-to-day conversation that we're having. Issues around poor, quality of air is also another challenge that is totally affected by climate change. Air quality is a key component of the environmental determinants of health. We have rising cases of cardiovascular people, mortality rate as a result of cardiovascular diseases and a lot of respiratory illnesses, especially, like the recent one we have that is still available and still trending all over the place, the COVID-19 pandemic. A lot of these cardiovascular issues, a lot of these respiratory illness are emanating because of, both indoor and outdoor air pollution that we're experiencing. And all this is coming as a result of climate change. These issues are here and they're causing a lot of impact on our well-being as individuals. They're causing a lot of impact on our economy. They're creating health conditions. They're creating new health, challenges, and they're also giving room for already existing health issues to also expand. And with all this happening, our healthcare systems are beginning to get overwhelmed. We're seeing a call for enhanced workforce in healthcare systems. We're seeing the call for health system strengthening, all because of the pressure mounted on healthcare. Now, if every single person is taking an action, is taking a climatic action, is taking a decision like what the nurses across borders is doing at the moment alongside its partners, to have conversations around climate change and to also see how some of these social determinants would be addressed. I believe that we're going to make very rapid progress in ensuring that things go down well. Now, we have diseases such as malaria that is a climate-sensitive disease, and whose global and regional distribution and seasonality are closely linked to temperature, rainfall, humidity, and social economic development. There are researches right now that are proving that resistant strains, Plasmodium Plasmodium parasite, right? Which is like the parasite that results to malaria, right? Now, Plasmodium parasites, they are beginning to get resistant to artemisinin, which is a key component of the combination drug that is currently used to treat malaria. We're seeing research proving that this resistance is happening in some parts of Africa. Because of climate change, as a result of this disease, malaria, being a climate-sensitive disease, we are seeing a lot of migration happening, that vectors such as the female Anopheles mosquitoes are migrating from some of these regions where this resistance have been experienced, migrating to regions that, have artemisinin as an active ingredient of their drug and is already working effectively. What happens is that over a short period of time, we begin to have this resistance experience in one part of Africa happening almost in different parts of the African continent. And this becomes a huge problem for us because we are no longer trying to fight malaria using artemisinin combination, but we need to now start investing more into research to come up with another treatment that will fight the resistance that is currently being experienced. The same issue we're seeing with malaria, we're also seeing with diseases like meningitis, for instance. Because of the heat, the serious heat that is experienced, the extreme heat, that is better than because of this climate change. We are seeing rising cases of meningitis in, some of, particularly in another part of Nigeria. And some of these challenges have, created overwhelming stress on the healthcare system we have in the country. We are making a lot of emphasis on Nigeria because we want actions to be taken, because we want each and every one of us to create a room where we can take action, because we want each and every one of us to be responsible for one thing or the other that will result to climate action and help us to reduce this impact or help us to mitigate the impact. Now, these challenges are just a few. We can still take a look at what is happening with flooding, right? In 2012, the flood displaced about 2 million people in Nigeria, and additional 100,000 was displaced in 2015, and we have additional 92,000 displaced in 2016, 250,000 displaced in 2017, and in 2018, NEMA, reported that about 1.9 people were affected by flood, which which has affected different parts of the country. Flood is no longer a Lekki business. It's no longer a Lagos business. It's affecting different parts. Here in Jos, we experienced flooding in 2019, and it was quite bad. Now, some of these issues are social and environmental determinants that are limiting the growth of our economy, that is affecting our well-being as individuals. I'll give you a scenario. During the flood that happened in 2019, a lot of cases were reported to the hospital, people being injured, building collapsing on them and all that. There was a serious health emergency. And with these emergencies rising, the professionals we had at the moment, at that particular virus facility area, were not able to salvage the situation, right? Workload was much because of the patient. And aside that, some of the primary health centers located in the villages where this flood happened were grossly damaged and affected. Some of these challenges are issues we are experiencing every single day. And there are issues we need to start paying attention to. There are issues we need to start raising our voices. We need to start raising our voices and start making contributions to see how they can be mitigated. It goes far beyond that, because if the issues around Lake Chad Basin, I was reading an article recently, and I realized that a couple of years ago, the Lake Chad Basin used to be around 40,000 square meters. But as a result of the climate change, the impact of climate change going down the line, the Lake Chad Basin, the Lake Chad itself, around the southern part of the Lake Chad, particularly that borders Nigeria, the water body there is around 13,000, just 13,000 square kilometers or square meters right now, right? And what has that done to the people living in that region? A lot of them there are farmers and fishermen. It has caused resettlement of these people. They have had to move from their community down to resettle in another community, And this is a serious impact. It's affecting food, it's affecting, it's going to create a lot of issues on food availability, and lead to scarcity of food and increased prices of foodstuff in the market. This year, 2021, we saw rainfall, the rainfall came in quite late. I was having a conversation with a friend yesterday, and she was telling me how their rice farm was completely a total loss. It was a total loss. And I asked why. She said because there was insufficient rain, and these questions, these issues are happening to different farmers at different locations. They're happening to different individuals, different organizations having agricultural farmlands at different locations. But because we're not paying attention to harness, to put the problems together, we're not seeing how huge they are. Until we go to the market to purchase a mudu of rice, or to buy a bag of rice, or to buy a bag of beans, and we're seeing that the prices are beginning to get high. And we're asking, where is this coming from? Climate change has a direct impact on that. If we don't have rainfall, our crops are encouraged. All these issues are things that we really need to start paying attention to. What of what it does to people living, the household of people? What of what it does to, to the livelihood of people, businesses, right? And how does that relate to their improvement? Now, when people's businesses are put on a standstill as a result of flooding, when people's businesses are put on a standstill as a result of one natural disaster or the other caused by climate change, they are totally displaced. They are totally displaced. They can't have good shelter to put their heads down. And when they are sick, they can't even access healthcare. We're still battling to see that universal health coverage is available, that universal health coverage gets across to, every part of the world. It's that we're trying to achieve with SDG2. But a lot of things are still involved. And climate change is limiting the effort that is made on different SDGs. I don't know how everyone looks at it, but from my own personal opinion, I think whatever effort we're making to ensure that SDG 1 to 17 is achieved, and we are not making serious commitments to SDG 13, which is climate action, then we are definitely wasting our time, because within a short space of time going forward, we're looking at between now and 2030, between now and 2050, there might be a very serious impact, right, on all what we are trying to build. In fact, the issues we are having now is getting far beyond just the now. We're looking at what climate change can do to our future, the future of the unborn generation. And I believe that is the reason why we're having this meeting today. It's very important that we take action to ensure that some of these social and economic determinants of health, that we take our own decisions, we take our own actions as individuals to ensure that we reduce climate impact, the impact of climate change, rather, on how some of these social determinants are related. Now, I want to just share a few strategies for mitigation and make a few recommendations as I round up my thoughts. Now, considering the pace at which we are responding to climate change right now, the WHO predicts that climate change is expected to cause approximately around 250,000 additional deaths per year between 2030 and 2050. And that's with the effort we're making right now. We're doing a lot, but it's not enough. We need to make more effort to ensure that this 250 additional deaths that is predicted or that is estimated to happen is reduced, right? And all these deaths, we're seeing that 30,000 of these deaths or 38,000 of these deaths could be due to heat stress in elderly people. And 48,000 of the deaths could be due to diarrhea, right? Could be due to diarrhea, right? Now we're seeing that 60,000 of these deaths could be due to malaria. And I want to strongly believe that the issue of resistance is also part of what we'll be discussing, even when we're talking about the 60,000 deaths. Now, 95,000 deaths could be due to childhood undernutrition. We've talked about what climate change is doing to the farmers, and nobody is saying anything about it. We're talking about, we're seeing what climate change is doing to the healthcare system, of how it's creating a lot of disease conditions that is overwhelming healthcare system. We need to start having conversations around this to reduce the 250,000 additional deaths that is predicted by the WHO, right? Now, this already have been witnessed with migration of mosquitoes, carrier-resistant strains, and all that. For us to take action, it is important for us to drive policies that will aid a reduction in emission of greenhouse gases, through the use of better transport. We need to start venturing into electric and solar-powered cars, right? We need to start using, food. We need to start making commitment towards food and energy choices, right? This can result to improved health, particularly, result to also reduced air pollution. We've seen a lot of the developed countries doing this thing. I know in Germany, Belgium, for instance, and I know some other parts of Europe, bicycles are encouraged. Rwanda started a program recently where you can just pick a bicycle on the street and move from point A to B. What is stopping us from taking that action in Nigeria, right? What is stopping us from creating programs like that? If it cannot be implemented at the national level, can we start implementing at community level? Can we start implementing at state level? Can we start from somewhere, right? It is also very important that we strengthen the climate resilience and environmental sustainability of our healthcare facilities. We need to start building capacities of our healthcare professionals. just like what Nurses Across Borders and its partners are doing right now. Highly commendable, I tell you, right? We must strengthen climate resilience of our health system. We must make deliberate financial commitment to health and climate change. It's not just about healthcare.
Ambassador, sorry, I'm not being rude. I would appreciate if you could just round up, because we have 3 more speakers and our time is running out. So we do appreciate all that you have done, please.
I'm actually just rounding up, right? It's also important that we establish, improve, and maintain robust and rapid surveillance systems for climate-related illnesses and vulnerabilities. Then we must also build protective factors and ensure adaptive capacities. Then finally, I personally believe that if we take action and implement the recommendation of the World Health Organization that was published yesterday, just like Pastor have read earlier in the course of his welcome remark, if all countries across the world and if all organizations and individuals are going to key into the 10 recommendations, in the COP26 special report, I believe we're going to make tangible efforts in the fight against climate change. And we're also going to ensure healthy living and well-being of ourselves and even as of members of our community. So thank you so much for having me this evening, and thank you for the opportunity.
Thank you, Ambassador Odinaka. Greatly appreciate your insight and your timeliness in this discourse. I'm not sure I see any question yet, but hopefully while the event is winding down, I'd like to invite one of my co-hosts, Ndidi Amaka Eze-Kechere, to introduce herself and invite the next speaker. Ndidi Amaka, please, the floor is yours so that you can introduce Alhaji Farouk and his representative, please.
Thank you, John. It's my pleasure co-moderating this forum with you. The next person I would like to call on is Dr. Deborah Awe.
No, sorry. Sister Eze, yeah, because of the network issues you had, so there's a slight change in the program. So the next person that should be coming on now will be the registrar and the general secretary to the Nursing and Midwifery Council of Nigeria, that is Alhaji Abubakar Oban Farouk, but is represented here tonight by Dr. Mrs. Dorothy Ore. And so if Madam Dorothy Ore is on, I know she's on, so the floor is yours, Madam.
Good evening, everybody.
Good evening, Madam.
It's a pleasure that we are called to deliver a paper on this wonderful meeting. And the registrar, in the person of Dr. Farouk Umar Abubakar, is appreciative of your efforts, especially on the effects of climate change and this impact on health and the roles of nurses and midwives to climate change. He appreciates the organizers of this meeting. It is indeed apt that this wonderful topic is being discussed today. We should not shy away from health promotions, which is one of the functions of nurses and midwives all over the world. He would have been here himself, but due to the fact that he has other crucial assignments, he now delegated that I should represent him in this visual meeting this night. I hope you people are hearing me.
Yes.
Or is there any network problem?
No, we're hearing you. We're hearing you, madam.
Is that right? The topic given to him is the health implication of climate change and strategies to mitigate its impact. The role of nurses and midwives to curb the impacts. The paper will be presented using the following outlines: introduction, health implication of climate change, strategies to mitigate its impacts, the role of nurses and midwives. Introduction. Climate change can be referred to any change in climate. These changes can be due to the climate change is affected by human activities, and it affects both living and non-living things, either directly or indirectly. Climate change has been coined as an increase in average atmospheric temperature caused by natural and human activities, such as burning, drilling, farming, deforestation, mining, gas drilling, and so on. When this average atmospheric temperature is altered, it can lead to global warming. Climate change is seasonal and is locational, because what happens in this country may not necessarily cause an effect in the other country, in another country closer to it. The health implications of climate change. Globally, climate change affects the ecosystem, both directly or indirectly. There was a study which investigated the effects of mental health of individuals as the season changes, either in hot weather, cold weather, and otherwise. In Nigeria, it has been reported that climate change is the underlying cause of many ill healths and risks, especially during the warm weather and dry seasons. Some diseases are weather related. For example, in one season, there is increased spread of diseases, carrier vectors, as the last speaker have already talked about elaborately on malaria and Plasmodium. So I will leave that because he's talked on it elaborately, and everybody understood what he meant when he said that. During this period as well, there is always increase in air pollution. And when we know that some diseases are related to filthy air, such as allergic reactions, asthmatic conditions, a lot of respiratory diseases and coronary disease occurs if the air is filthy and it becomes toxic. Furthermore, during the dry season, there is also health consequences. Our aquatic animals are affected, and agricultural productivity is equally affected, because we know that agricultural produce can only yield good inputs during the rainy season, let alone during the dry season. That's why In some parts of this country, they use irrigation and dams during the dry season to augment the productivity of the agricultural produce. There is equally evolution of efficiency of the viruses. Climate change is involved in prevalence of parasitic diseases such as protozoan diseases and soil climates, filariasis, Chagas diseases, schistosomiasis, as well as livestock parasites. Strategies then to mitigate these impacts. A finding from a research work indicated limited knowledge of health related and risk of climate change among different populations, and ours inclusive, Nigeria inclusive. Based on this, sustainability of communities and environment for both territorial and aquatic lives must be maintained. The government is paramount to sensitize the public, manufacturers, and oil companies on climate change in order to improve and reduce the climate change impacts on human and other things. As a regulatory body that Nursing and Midwifery Council is advocating that all training institutions in Nigeria should be strengthened to respond effectively to this emerging hydra called climate change by ensuring that climate change is embedded as a course in students' curriculum in all levels of health education in Nigeria. Climate change poses significant challenges to human health around the world, of which the last speaker has equally elaborated upon when he was talking about malaria and so other social changes as a result of climate change. In the same vein, for us to address climate change effectively, data collection should be enhanced through monitoring and surveillance to build the basis for a collective understanding of causal effect relationship between climate change and health, to ensure better support of public health action and decision-making. Because we can only discuss effectively when you know the cause and effect of any prevailing disease. There should also be effective quality public health practices, which should be built upon data collection and its interpretation on health status, health hazards and their outcome will provide valuable long-term data, which will help us in planning, bringing out the strategies, reviewing government's health policies, then form the basis of health communication for disseminating information to stakeholders.
John, I think we're having an issue with Dr. Dorothy.
Yes, I figured that much because her screen is frozen. While we hope that she can, her internet will be restored, we hope that she can restore and probably share her recommendations going forward. I think at this point, I would invite India Maka to read out that of the next speaker, which is Dr. Oluwafumilayo Dorcas Awe, or rather Dr. Awe Oluwafumilayo Dorcas. So I'll let my co-host India Maka to quickly read her bio and invite her to speak. India Maka, please.
Okay, John, thank you very much. I'm sorry for the interruption in the network. It's my pleasure to co-moderate with you. My next speaker is the lovely lady, Dr. Deborah Awe. She's a highly motivated, team-oriented, and resourceful medical doctor. She was affiliated with over 12 years experience in treating patients for a variety of conditions, medical research, and capacity building. Her areas of expertise include epidemiology, infectious disease modeling, survival analysis, data management, reproductive, maternal, child, and adolescent health. She has a master's degree in medical statistics from the Institute of Tropical and Infectious Disease, University of Kenya. So, my dear doctor, can we hear from you? The floor is yours, Dr. Awe.
Thank you very much. Can you hear me?
Yes.
Okay. Good afternoon or good evening, everybody.
Good afternoon.
I just wanted to clarify that. I'm Deborah, Oluwafunmilola Deborah Awe. And it's my pleasure to be here with everyone. I know it's been a bit, it's been a long day, and I wouldn't want to take too much of our time while presenting. Well, let me just cut to the chase. I'm presenting climate change and disproportionate effect on women's health in Nigeria. That's quite a mouthful. I'll repeat that. Climate change, disproportionate effect on women's health in Nigeria. This is I don't know if you can see my slide. I just put in a bit to follow. Yes. So I'll be talking briefly about climate change. Many of my predecessors have already spoken a lot about climate change. So because of our time, I might cut off some parts, but then briefly I'll talk about the causes and the sources of climate change, because if we know that, we can know how much it impacts on women's health, which is the target of my own presentation. And then we'll talk about the effect of these climate changes, gender role in climate change, because that's one evolving part in climate change research. You know, it's not where research, most data just gather data and they do not put emphasis on the gender difference in the impact of climate change. And also I'll be talking about how of course we know that there are effects, there are negative effects, especially of climate change on humans as a whole. But then what is the perspective? How does gender, belonging to a gender, affect these climate changes? Then we'll now talk about the core topic, that's the disproportionate effect on women's health in Nigeria. And then how do we reduce this impact of climate change on women? And then I'll conclude very briefly. Then if there are questions and answers, we can take that briefly. So my introduction, my way of introduction, I wouldn't just want to Because when we talk about subjects, we make a lot of assumptions, but what do we actually mean by climate change? Because there's a lot of terminology. You talk about global warming, we can get confused. But of course, climate change simply means a long-term shift in temperature and weather patterns, which sometimes might be as a result of natural reasons, because of course, all these chemicals that are, what are the gases that are released that causes climate change are also can occur as a result of natural, nature, from nature directly, maybe from grasses or so whatever, what have you. Also, it can occur majorly as a result of human activities such as burning fossil fuels, mining, energy generation through transportation. We've talked a lot about that. And also, as a result of this, all these gases, we call them greenhouse gases, that is emitted from all these sources, can accumulate in the air, build up in the atmosphere, and cause overall warming of the planet, which is the reason for what we are talking about. So what are the sources? Briefly, I'll rush through. We talk about the rapid industrialization, which encourages people to use other sources, like maybe, for example, a lot of people are buying more cars, industrialization, many people are building houses, and then somebody has talked about generator. Everybody has generator, in fact, even in I Face Me, I Slap You houses, you see, like everybody has a generator, all these things, because everybody wants to come to the city. And so you see rapid industrialization, building of other maybe industries are also affecting the climate condition. Also, other things like agricultural practices, deforestation, consumer practices, livestock, transportation, and all other things. So at the end of the day, this causes rising temperature, rising sea levels of all these gases, which of course affect sea life, unpredictable weather patterns. In Nigeria, now sometimes you say, oh, this is rainy season, wet season, everything is overlapping nowadays, not just in Nigeria, and many other parts of the world. And also there's increase in extreme weather, extreme heat and extreme cold. Then you see a lot of flooding. When you see in areas where there are no rainfall, and then you see when rain falls, there's extreme rainfall, and then there's flooding. Also, there's degradation of land, loss of wildlife and biodiversity, and so on and so forth. This leads to, of course, displaced people, poverty, loss of livelihood, hunger, malnutrition, increased risk of diseases. Now, for the purpose of this study, I'm going to skip through talking more about the sources. I'm going to talk about the impact of climate on human health. I don't know if you can see my slides clearly, but if you look at it, the picture I'm displaying right now, we see that the rising temperature, of course, causes severe weather. You see, this can lead to a lot of injuries. Some people having heat stroke, heat-related diseases, increased cardiovascular disease, and so on and so forth. Also, there can also be environmental degradation as a result of increased CO2 levels. Now, women specifically need to understand that gender roles have a part to play in climate change. So we say that gender differences result from variation in physiological, behavioral. Hello?
Yeah, we can hear you.
Good. So I hope I'm fast. I've been given like 5 minutes, so I'm trying to.
No, you have 15 minutes. So go on.
All right. Okay. So we say that gender differences result from variation in physiological, behavioral, and social roles of these genders. And it has been found in research that gender plays a significant role in how much climate change impacts on human beings. And we see that climate change acts as a so-called health. It's not just the impact of gender on the climate. You see that the climate change now serves as a kind of health threat multiplier, like something that wouldn't have been so exposed because of the fact that gender, of course, there's already issues, especially in developing countries, especially in Africa, where we see a male-dominated environment. Apologies to our males, but then culturally, you see, and the factor of climate change, it acts as a kind of health threat multiplier through a multifactorial framework of direct and indirect mechanism, increasing health inequalities that already exist. So many of the health risks we have seen are likely to be affected by ongoing climate change with different gender impact. Now, many studies have highlighted one of these differences I want to run through briefly before I now talk about on women. You see, many studies have highlighted, can you imagine that unmarried men are more likely to die from heat waves, you see, than unmarried women, and also men suffer more mental problems than women. That is, they would commit suicide because of climate impact, or maybe they have lost their home and every other thing. However, natural disasters such as drought, floods, and storms have been found to kill more women than men. Of course, women, because of the way they are made up, they are not as strong as men, and they may not be able to even escape when there's a lot of, when there's drought, flood. A man would escape, would climb a lot of stuff to get out of danger, but women are vulnerable. And so natural disasters such as drought, floods, and storms have been found to kill more women than men. And they tend also to kill women at a younger age. That is, the younger the woman, the more likely the person will be affected and killed by natural disasters. And we see that all these factors have been reinforced by the nature of events and even social status. Now, we have talked about the impact of gender on climate change and climate change on gender. We see that to further aggravate this situation, we see that women with lower social economic status also are more affected than people with more higher social economic status. This is that you can go through there's a lot of study that back this up. So we see that gender gap effect on life expectancy tend to be greater in areas. I repeat that the gender gap effects on life expectancy tend to be greater in areas where there are more severe disasters and in places where the socioeconomic status of women is particularly low. So globally, we find out that, of course, women are more predisposed to dying as a result of natural disaster. But then in areas where you now have more severe disaster, we see that this gender gap further widens and affects women. So now I want to talk about other climate-sensitive health impacts. You see, also, women are more prone to be undernourished in a situation where there are disasters, and also prone to have malaria and other issues. Now, let's talk about the disproportionate effect on women's health in Nigeria. Let's come back home. I've talked about the fact that gender has a role in affecting in climate change, and then climate change affecting different genders in different ways. Now, the effect of climate change, we find out that it's in affected regions at elevated risk. I've mentioned it, some of it earlier on. It puts them into an elevated risk, higher risk of having malnutrition, also sexual violence. You know, because of if I have time, I will give you some scenarios which I got from you see, women being exposed to rape. You know, they are displaced from their home, and then because of disasters, natural disasters like flooding, and so they're exposed to having rape, to being raped. They're exposed to contracting a lot of diseases, and so also it affects their mental health, and also it affects their reproductive control, because many of them also, because of displacement, they're not able to access the healthcare system when they are maybe perhaps they are pregnant, or it increases the distance from medical care. And it has been found also that there is also negative obstetric outcomes. Hello?
Go on, we are hearing you.
Yes, so it is noted, you know, that Nigeria is recognized as a fossil fuel dependent economy with a large climate sensitive agricultural sector. It's found that women in Nigeria are responsible for 70 to 80% of all agricultural labor. But only 10% of landowners in Nigeria are women. Where am I going? How am I, as in what exactly am I trying to say? We see that because of the patriarchal nature of especially maybe in the southeast, in the northern part of Nigeria, and then some part of even in the Yoruba, in the southwest, we see that men, by patriarchy, when you see men get more. If, for example, if you have a system of society or government in which the father or eldest male is head of the family, and descent is traced through the male line. You see, this system equips men in such a way that they have a stronger adaptive capability, especially in area of vocational flexibility and mobility during a disaster. You see, for example, now, women, okay, they contribute 70 to 80% of people that do farming, you understand? And then only 10% of them have asset, can say, okay, I have monotony, I have autonomy, I am the one in charge of this land. You can imagine now, there's now a natural disaster. It further reduces their ability to even do things the way they would want to do. Many of them are displaced. And so because of, it has been found that this land deprivation will make women more vulnerable to climate-related problems. And so we see that this traditional beliefs in many, especially in areas of Nigeria, we see that this traditional beliefs affect the cultural division of roles between men and women, which further aggravates the vulnerability of women. Women are already vulnerable anywhere in the world, but the fact that beliefs further aggravates even the role of women, which further worsens, aggravates the effect of climate change. Also, role divisions, rather than empower women, deprive them of important opportunities. For example, in areas, in places where, okay, let's talk about these things. How does this particular issue affect you? Let's say you have a council meeting. Rarely would you have women being put in charge. And I said earlier on that 70 to 80% of women are farmers. Farmers are women. And they are still not in the forefront of deciding their fate, when issues, maybe disaster, crisis occur. And so this further puts them at a disadvantage. So the role division also is further affect gender, further affects women and then impacts them in such a way that they are more affected when there are disasters, especially related to climate. And so furthermore, decentralization of activities of women's occupations such as small scale, I'm talking about why they are more predisposed. What makes them even more vulnerable in Nigeria compared to other parts of the world? You see, furthermore, decentralization of activities of women, so occupations such as small scale and rain-fed agriculture makes them more vulnerable to climate-related problems, especially in these areas now when we have a lot of kidnapping, banditry. You can imagine how vulnerable women, even men are vulnerable. So how many women would want to go outside, coupled with a lot of issues. So all these things come together to aggravate and further worsen the situation of women in the face of this prevalent, even negative, climate change. And so we see, like I said earlier on, the traditional gender roles mean that women spend, of course, comparatively greater amount of time. Okay, if they are not in the farm, the other majority of women are at home. Especially in the rural, even amongst the relatively rural urban area, I would say in between the rural urban area, you see women stay more at home than men. And because of that, they're also exposed to indoor particulate matter. Like, for example, they cook, they're the ones that cook, the traditional gender roles, compared to maybe these developed worlds where at least one way or the other, almost equal, we have almost equal roles in the kitchen. Of course, and they don't even use all these things we use in Nigeria. And so because of the fact that they're exposed to indoor particulate matter, like maybe when they're cooking with stoves, the kerosene, the CO2 being emitted from firewood, and of course they are more exposed than their male individuals. And inhaling such particles results in increased risk of cardiovascular, respiratory outcomes, and fetal maternal outcomes. We see that exposure to air pollution during pregnancy has been linked to decreased lung function in children and childhood, and then they can have increased predisposition to having asthma and other upper respiratory tract infection like chronic obstructive pulmonary disease. Of course, we know that pregnant women, I don't want to assume that, of course, we know we are elite. We know that pregnant women, of course, are less able to regulate the temperature of their bodies. Many women would say that, oh, normally they even feel hotter than normal. But then you can now see when they're exposed to even more global warming, you have increased temperature, because the end result of all these increased gaseous substance in the atmosphere is, of course, we have increased temperature. Now, pregnant women normal physiologically are less able to regulate the temperature of their bodies. And so because
excuse me, Dr. Awe, I would appeal if you can round up in 3 minutes.
3 minutes, thank you very much. Okay, so because of this increased temperature, of course, they have more dehydration, the fetal outcome might be worsened. Some of them, their children die. I mean, the fetus die. So, and also there are a lot of things I would have loved to talk about. I mean, the effect of this climate change on women, but because of our time, let me round off basically. You know what makes it worse is that in research now, we don't have a lot of gender disaggregated health data so that we can adequately measure the impact of this climate change on women. And because also female voices are rarely being heard. So I would say there are ways we should go about reducing impact of this climate change on women. The first thing I would advocate is that there should be empowering of women as educators. You see, those people that are more affected should be the ones in front. You see, the government should let women talk. You know, we should let women talk and talk about how much of this has impacted on them. And also there should be a lot of, my previous predecessor has talked about how to mitigate it, so I wouldn't talk about it. There should be a lot of workshops, seminars like this, which I appreciate the organizers for bringing it up. You see, like this, we can then talk about how much this has impacted on us. Also, innovative urban designs, where we design things, houses in such a way that, of course, does not help, you know, then alternative use, I mean, cooking fuels, alternative use. Then also we talk about, I don't want to go beyond the 3 minutes. Of course, we should involve households and individuals, and we should learn to adapt to the threat of climate change. And we should be, we as even, let's say, people on the receiving end of this climate change effect, should be ready to share information with other stakeholders about daily experiences they have. And in conclusion, climate policies must address underlying causes of vulnerability, such as gender inequity, to prove successful. Funders, researchers, and health professionals should therefore direct their attention to this knowledge gap, of course, by funding researches that would put gender in perspective, and so can address the effect of climate change on society and human health. And also knowledge, especially our perspective about genders in these discussions, are central to developing sustainable solutions for the biggest health threat of our time. Thank you very much for having me. I wish I had a little more time to put my thought in perspective, but I believe I've been able to pass one or two information, and also to sensitize us to the impact of climate change on women's health. I'd like to take questions and answers if there is any.
Yeah, we'll take that at the end of all the speakers. So we just have to move on to the last speaker.
Okay.
So yes, John,
Okay,
over to you.
Thank you, Dr. Awe. There are already some questions in the chat box, but to keep it until just a few more minutes after the last speaker. So I would invite Dr. Ndidi Amaka to, Mrs. Ndidi Amaka, to quickly introduce the last speaker.
John, let me introduce her quickly, please.
Yeah.
Okay,
the last
go ahead.
Okay.
Yeah, hang on. Because Dr. Osikan has about less than 5 minutes to be with us, so we're just going to rush through this quickly. Osikan George Amana is a climate science researcher and a sustainability practitioner with over 12 years of international technical cooperation on low carbon development pathways. She has a disciplinary niche in climate adaptation science research and socio-ecological systems. She has strong cross-cutting work and professional experiences in the SDGs, governance, gender, and international climate policy diplomacy. As an interface practitioner between scientific research international development policy. She has extensive private sector engagement in trans-boundary climate partnerships. She has consulted for municipalities and governments in Sub-Saharan Africa and Germany, working to improve the trans-boundary cooperation on climate change response between African and German municipalities. She has emphasized mitigation policy interventions projects, including the assessment and rating of the green gas emission standard certification framework to ensure market integrity and value for impact buyers. She's through her role in the West African Alliance on Carbon Markets and Climate Finance, contributed to mitigation policy interventions in cities and municipalities, and promoting private sector involvement. So it is not an error for Dr. Usika to be speaking on the role of the private sector in financing climate change in Africa. So Dr. Usika, we're happy to have you on, and you please have the floor. Thank you very much.
Thank you very much, Pastor Peter, for having me, and good evening, everybody. So Pastor Peter contracted me to speak on this topic, and I was happy to share my views and my experiences having worked across the globe on this issue of private sector financing. Well, it's very easy to add this. It's very easy to add the puzzle together. So the first thing is, it is the way of life, the businesses practices that brought us to where we are today. And it also needs the same business practices to get us out of where we are today. That is the basic understanding of where I want to go and what this is all about. So private sector financing in climate change. The last speaker had tried quite laboriously to give the very elementary understanding of what climate change is. And I think everyone now understands what it is from the last speaker. I have been asked to speak on the role of private sector in the role of private sector finance in supporting climate change actions in sub-Saharan Africa. And it's not just about sub-Saharan Africa, it's about the entire globe. Because like I said earlier, it is a business practices that's brought us where we are, and we also need new innovative business practices to get us out of where we are. So why do we need the private sector in climate change discussions? We need the private sector in climate change discussions because it's very clear that public budgets cannot deliver the ambitious targets which we all want. In 2015, everyone knows that there was a remarkable climate change agreement, which is the Paris Agreement. Why was it remarkable? It was remarkable for the first time, not only because of the consensus, the overwhelming consensus that very many countries acknowledge the need to go beyond 2 degrees Celsius, beyond what we used to have the pre-industrial era. It was also a landmark simply because Paris Agreement came out with a framework that acknowledged that government and public state actors alone couldn't drive change in climate change issues globally. It was a framework, the Article 6 framework was a framework which we call in the climate community the market article framework, which means that it actually acknowledged not just the role of private sector in catalyzing finances for climate change actions, but it also realized that a private sector could do more than just catalyzing finances, but also in changing business practices and in changing the way which we do business as usual. So what we are talking about today, it's about reducing business as usual emissions to an emissions that the atmosphere can tolerate. Now, to get the private sector working, which Article 6 has already provided in the Paris Agreement, is to create an understanding that the private sector, unlike conventional financing instruments, that the private sector now becomes one of the key major decision-making organs or bodies in climate change, international and global climate change response agenda. it means that the private sector will begin to play a role that goes beyond just providing normal development assistance or ordinary climate finance, but that the private sector would veer into the carbon market to upscale and to scale up funding for mitigation. Now, I'll give you an example. If we need, for example, $200 million to create an energy-intensive development infrastructure that will provide socio-economic services, provide socio-economic product for the social benefits of people, it means that the government or the public funds are providing this $200 million for a business as usual emissions. And therefore, we need the same private sector to bring funds to help us produce or to help us achieve quantified emissions reductions. And so the private sector plays a very critical role, like I said earlier, in taking part in the decision making, and also in beginning to move from the usual business practices to a business practice that acknowledges the need for a low carbon technology and a low carbon economy. Now, how can the private sector contribute to this? Now, mitigation is very expensive. It is the same thing as looking for money to do energy intensive investment. Now, the mitigation is expensive because it requires incremental mitigation costs. And incremental mitigation costs cannot be borne alone by a government, because the government is already weighed down with the provision of utilities and social utilities and social services. And therefore, the private sector is the only a non-state actor that not only has experience in finding innovative finance, but has the experience in getting into the market. So now, like I said earlier, Article 6 of the Paris Agreement has actually opened up a new field of engagement that has actually lifted climate change from the scientific evidence which we have known, from the political evidence which we have known, into the market space. And so the private sector is a very critical agent or agency in playing this role in the market space. The government can't play this role in the market space. It is the private sector that can play the role in the market space. And now, just to round off my point, is we are beginning to have green businesses in transport, in housing, in packaging. Now, these are all sectors, and these are all medium scale enterprises. These are all sectors where people have we have informal activities, we have formal activities. And so the private sector can not just stimulate actions in this green economy, but can also begin to mainstream climate financing in these green sectors. So I give you an example. If we have we have small scale enterprise businesses that are beginning to change their energy sources, their sources of energy. Now, this is the private sector that can provide funding. It is the private sector that can provide funding for such medium scale enterprises to change their sources of energy. And this is just one of the very many examples of how the private sector can provide and scale up funding, or can intervene, or can participate effectively in the global response to climate change. That's one. Two, there is, for example, there is a program by the World Bank, by the International Finance Corporation of the World Bank, which tries to provide climate financing for small scale enterprises to get into the green sector, to mainstream climate into their business practices. And this is just another way in which the private sector can participate in upscaling and in driving climate response at both at national and at international level. The other way in which private sectors, like I mentioned earlier, market spaces, is about the private sector can work collaboratively with the government in shaping macroeconomic policies, because before now, the government has been used to macroeconomic policies that actually incentivizes business as usual scenarios. And we are beginning to talk to governments, not just in Africa, but also governments internationally and in other parts of the world, to begin to look at the macroeconomic policies that can offer risk mitigation and also offer incentives and spaces where the private sector can actually negotiate, can actually take part in the shaping of macroeconomic policies. So the private sector can, as everyone knows, can play a very strong role in driving climate change actions. Now, to bring home my point, I am involved in the West African Climate Alliance on Carbon Markets and International Climate Finance at the Sub-Saharan Africa level. And we are working with ECOWAS, working with the German government in implementing this program. What I have learned as a program manager in this program is that Africa as a whole, not just Sub-Saharan Africa, Africa as a whole needs extensive participation of the private sector in delivering climate change mitigation or our NDCs. Now, we have, for example, we have 16 West African countries who are participating in this program, and they are trying to develop mitigation activities in the sub-region, trying to develop energy projects, trying to, for example, cooking stove and so many mitigation projects that can help in introducing energy efficiency. Now, we haven't been able to leap beyond what beyond the grants which the German government has provided. Why? Because climate change mitigations or low carbon economy is it's a financially intensive activity. It's a financially intensive process. And so we are now beginning to look outside, because we can't afford in Africa to have private sectors who, first of all, understand what it means to get into climate financing. First of all, who don't have an appreciable level of knowledge of what it means to finance mitigation projects. So we are now looking across into Japan, to Sweden, to Norway, to international, we call them EAT-mode buyers because they buy international transferable mitigation outcomes. Why? Because we need finances from the carbon market to finance this project, which Africans at the West African sub-region have identified ideas, mitigation ideas, in implementing and developing mitigation activities, but we don't have the money, don't have the financial capital to take this from the design level to the implementation level. So this is a clear indication that private sector financing, not just the conventional overseas development assistance, not just the conventional multilateral financing, or not just even the climate adaptation finance and other international climate finance instruments are not enough to support mitigation activities at the scale which is needed to reach an ambitious level of cutting down emissions within the context of the nationally determined contributions. So climate finance can play a very critical role and will continue to play a very critical role in a global climate response. And I thank you very much for spending your time to listen to my views. And I welcome remarks, welcome questions and feedback from people. Thank you very much.
John, thank you very much. Okay, go on. All right, John.
Thank you very much for sharing your views. Before we let you go, we are seeing some questions. I would allow my co-facilitator to take those questions quickly, read them out, and let's see how the speakers would answer to them. But I'd probably take a quick go, but I'll let my co-facilitator take that. Amaka, please go ahead.
Yeah, quite interesting. I believe and hope with all this year, 2021, we all will wake up to climate change. I've lots of questions and comments are taken in. But I'm going to pick two from the chat box. It says if they can highlight how the rural dwellers can be sensitized on the effects of bush burning and human health and climate change. Another one from the same person, it says, how will the team increase the knowledge and improvement in rural areas where bush burning is extensively practiced? These questions came from engineer Emmanuel Nwachukwu is with the Shell Nigeria, Port Harcourt. Then another question.
Yeah, no, I think let it take it number one. I think that question will be better handled by Odinaka, who spoke much on the effect of climate change or the social and health determinants earlier on. So if Mr. Odinaka is there, could you please just spend 1.5 minutes to just respond to that question?
Okay, thank you so much. Thank you, engineer, for that wonderful question. In the course of my submissions, I was saying that climate change is an issue that affects every single member of the society. And now we have isolated the issue of bush burning, and we're laying emphasis on farmers. I think there were two questions that formed the entire question he asked. The first was how, this message can be sent to the farmers at the community level. And I want to believe the second question was about climate change. It was two questions together. Okay, how this wonderful team will increase the knowledge and hence improvement in rural areas while bush burning is a sensitive practice, and how rural dwellers can be sensitized. The message has to be passed, at different levels. We have the Association of Farmers, that is existing at the national level, is existing even at community level. Just like what we're having today, this conversation is featuring nurses, is featuring medical doctors, lab scientists, featuring everybody all together. We're having this conversation and relating climate change to health. We can have an extended conversation with the Association of Farmers in Nigeria, and they have membership representation even at community level. We can discuss these issues with them and provide solutions on how this can be done. And you can't be telling people to stop a practice they are used to over the years without providing a solution, for them. So we need to start thinking towards what alternative there is to bush burning. We need to start answering the question of why these people are getting involved in bush burning in the first place. Then we need to start providing solutions. What can they do to ensure that their soil, is improved? What can they do to ensure that they have better yield? And what can they do to ensure that the bushes they have around them, is taken away aside from burning them completely. So we need to create solutions or create alternatives to, for farmers, who practice bush burning, and provide these solutions to them through an effective engagement with the National Association of Farmers in Nigeria, both at national level, at state level, and at community level. It's not too far. A lot of the farmers currently are even on social media. We could use social media as a tool to pass the information. A lot of farmers listen to radio. We can create programs on radio that addresses climate change. I listen to radio a lot. I'm also a journalist, and I work in the radio house. I want to tell you that I have not seen any program that is designed to address climate issues. You understand? I've not seen one program within the 6 years of my practice. So this is another issue we need to start looking at. We need to start sourcing funding to see how discussions can be held on climate change impacts and, how these programs can be held on radio and even on TV to create proper enlightenment for farmers and help them, address this issue. So thank you so much. I don't know if that helped. That was helpful, please.
Yeah, thank you very much, Ndidi.
Thank you, Odinaka. That was quite explicit. I remember while the preparation for this consultation was ongoing, there were two key issues that were raised. One is bush burning, and the second is gas flaring target. Now, these two issues were supposed to were supposed to go through the Senate committee chair, who is handling that and trying to see how these issues can be addressed by raising awareness on the linkages between bush burning, soil health, like you rightly mentioned, and agricultural produce. Also, there was the concern about gas flaring. So it comes back to what we as individuals we need to do. Everybody needs to take action and take action now. Having said that, I would just take the second question that Engineer Iman Wanchuku shared, which he raised, and I think Nsika will be in the best position to answer that. He said, throw more light on carbon credits in private sector. It will be helpful if you can just share more and on that. Nsika, you have the floor.
Before Nsika takes the question, there's another question so that you will just address both questions together. It says, what will be your advice for youth towards harnessing the private organizations' financing opportunity? How should they go about getting empowered? So, Dr. Nsika.
Okay, thank you very much. So let me start from the first question about carbon credits. I mean, carbon credits came in many years ago during the Kyoto Protocol regime, when UNFCCC thought it important and thought it sensible to place some sort of obligations on developed countries in order for them to reduce their their carbon footprint. So carbon credits are tradable units in the carbon market, and there are basically two types of carbon credits. There are carbon credits that are tradable units, and there are carbon credits which means you can go to the carbon marketplace and buy this unit to offset your mitigation footprint. That means if you pollute too much, or if you go above a certain limit, and let me also draw us back a little bit. So government, like I said earlier, government saw this carbon credit as a measure against developed countries or industrialized nations in reducing their emissions footprint. So you would have an allowance, and if you polluted or emitted beyond this beyond your allowance, your emissions allowance, you would either have to buy the units from the government, the allowances from extra allowances, or go to the carbon marketplace to buy tradable carbon units. And then later, just before Kyoto, before the life cycle of Kyoto came to an end, the voluntary carbon market sprung up, which means individuals began to get to participate in the carbon market, and not just waiting for, because what we had earlier was government compliance carbon market. So individuals began to get into the voluntary carbon market to develop projects that they could get verified for their mitigations, get verified for their associated sustainability indicators. And once they got this verified label from Gold Standard, from very many different standard organizations, they were able to sell this as verified, quantified, verified carbon units. And now, so carbon units, carbon credits became not just, they moved away from being a penalty into being a source of transaction, into being a source of funding for raising climate finance. So it moved away from being a penalty from the government to big industrialized nations and big corporations like Amazon, for example, who were at that time really not in grasp with their sustainability practices, with their environmental integrity practices. It moved away from being a penalty and for a court and sort of a precautionary or a cautionary measure into a market a place measure. So now we have carbon credits being sold in the international carbon markets, being transferred under the Article 6 and as international transferable mitigation outcomes, meaning if you pollute in Europe, you can afford to invest in Africa and offset your emission footprint, which you have done in Europe or in North America, with some like a clean development mechanism, with a project that can produce, first of all, can reduce emission and also produce SDG co-benefits and can be verified by gold standards and other standard organizations. That is what carbon credits are. And presently, under the Paris Agreement, under the Article 6, 6.2, and 6.4 of the Paris Agreement, carbon credits have risen to a prominence that, first of all, because it is needed in fulfilling national determined contributions, meaning that every country around the world, both developed and developing countries, now have an obligation to cut their emissions. And these obligations is being required by the UNFCCC to be documented in a document called the National Determined Contributions. And most of these national determined contributions, which are like a blueprint for from every country, voluntarily stating how far they can go and how ambitious they can be in cutting their business as usual emissions, have two parts to this document. Some of them say we are able to cut our emissions conditionally, which means we are going to depend on international support. And like I said earlier, most of this previously international climate finance are not sufficient in helping countries to cut their emissions. So now countries are now getting into voluntary cooperative agreements with countries that are able to invest in Africa in order for them to buy carbon credits to offset their emissions in their countries. So carbon credits has got a reason in prominence, reason in relevance, from being just a penalty measure in the days of Kyoto Protocol to the days of Article 6 under the Paris Agreement, as being a market instrument for realizing ambitious climate mitigation achievements. So that is what they are. Now, to the next question. Thank you very much, Speaker, for this insightful presentation. And second, what would be your advice for youth towards harnessing private organizations' financing opportunities? Now, the thing is, we are having, first of all, we are having this challenge, particularly in Africa. The challenge we're having in Africa is that the private, first of all, the understanding of the role of private finance or private investment, because climate change mitigations are investment related discussions, is that the private sector in Africa is still very, sorry to use the word, a little bit limited in perspective as to what the private sector can offer, or as to its role in global climate response, or even at the regional, sub-regional level. So it is difficult to say. First of all, they have this challenge of understanding how well they can fit, and how relevant they have become over the last couple of years, especially in the last 5 years since the Paris Agreement came to stay. So now, asking for how youths can take advantage is a little bit tricky, because first of all, the people who you want to take advantage are not just aware of their relevance or their role in global climate response. But that being said, what the youth can do is to get into the knowledge enterprise, into the knowledge space. And what I mean by knowledge space is by having that enthusiasm to learn, and to learn beyond what the universities can offer. We are speaking today because we went out of the limits of what the universities in Nigeria could offer us, and even what the limits of the universities even abroad could offer us. So it was a self-investment in wanting to know. And when the youth get into a self-investment in wanting to know, then you can as well become an influencer that can help the private sector in Nigeria, in sub-Saharan Africa, to understand where its role in what we are discussing. So that is one way in which the youth can also drive this conversation, can drive this movement, and not just trying to wait from the recipient, being a recipient, a passive recipient, waiting to be fed, but rather taking that very bold step in getting into the knowledge space. It is a knowledge enterprise that you can raise awareness and begin to show people a way, begin to show people explore, open up new perspective to private sectors in Nigeria. So, and let me also add, there is a myth, not just in Nigeria, not just in Africa, but there's a myth globally that when we speak of private investment or climate finance or green finance or whatever name, it has different nuances all over the world. When we speak about private sector investment in climate change, people begin to think that it must come from people like Dangote. People begin to think it must come from international corporations, Amazon, Facebook. No, private sector intervention in climate change starts from the very micro, macro, small, medium scale enterprises. It starts from a decision to change practices. It starts from a decision to even be part of the movement. It starts from a decision of changing the way people package, moving from polythene packages to paper packaging. These are the ways in which private sector, be it small, be it medium scale, get into this business. So that is what I would say. Thank you very much. The next question, please.
Okay, I think John, because of time, Dr. Sika, don't go, because I mean we have a small ceremony we want to perform for you leave for all the speakers. Can I quickly call on Mr. Rotimi Ajayi? Mr. Rotimi Ajayi is the Senior Special Assistant to the First Lady of Osun State. The Office of the First Lady is also a partner organization, entity with us across the borders in the area of women empowerment. So we collaborate in the areas of the Commission on the Status of Women. But today he's here. He's going to ask his question, and they just make a brief remark. Mr. Ajayi, you have 3 minutes. I'm going to stop you after 3 minutes. I hope you wouldn't mind, and just be here with us.
Thank you, Pastor. I thank all the speakers that have spoken on the various aspects of climate change. Quite illuminating. However, I need to ask, mine is not more, it's not much of a question than to just add to it yes, for now, by my engagement at the moment, I operate in the rural area of Nigeria, and before now, I was so much into climate governance at the federal level, in the Federal Ministry of Environment. Then I was with the special assistant to the Minister of Environment and a member of the National Committee on RED. However, since I got to the rural area of Nigeria, I discovered that climate change sounds something like an exotic thing to our people in the rural area. And when this thing came about today, particularly the impact on Earth, I became so happy about it, because one, when you look at the people at the rural area at the moment, they do not properly understand the full implications of climate change on them. And so the lifestyle, the way we live, still continues to be like, okay, fine, this thing is a foreign item that doesn't have any implication on us. So I want to advise that we need to widen our network to engage the governors, the local government administrators, on various implications of climate change, particularly on Earth, to our women, and then to the youth generally, who are interested in the financing and everything that Dr. Nzikan is talking about. On our part, I think I've been trying to get the first, using the platform of the Governors Wise Forum to key into the of climate change. It's a long run battle. I mean, it's not an easy thing, but eventually we're going to get to that. But I will continue to key into the arrangement being by the nurses across the borders. Thank you so much for giving me the opportunity.
Thank you very much, Mr. Ajayi. We appreciate that, and thank you for representing the people of Osun State. We actually look forward to the continuous collaboration with the first lady in this regard. Ladies and gentlemen, I want to apologize and appeal that we will not be able to take any more questions because we must leave this platform plus or minus 9 p.m. There are questions that are on the platform. The one asked by the one that is talking about how can the youth access fund with the UN and all that. Just like Dr. Zikan said, the issue, majority of people who are in the civil society or are into the non-government organizations activities believe that when you are into this activity, the first thing you need to look out for is how to get funding for everything. I must let you know that in the area of community job, all matters is our passion for what we do. It's not about the money. So the little way you can impact your society or the environment you stay is by you manifesting the changes you want to educate or sell across to others. He said, if you must change, the change must start from you. And so to my youth, to the youth who are here with your organization, part of what we are doing now is one way for which we didn't have to look for funding look for $100,000 to do anything. What we do is just self-sacrifice with using our own idea, educate and build the capacity, put together and inform them. As nurses, part of what we are doing is this, because when you empower the nurses, you are empowering the community. The nurses and every other health worker stay with people, the patients 24/7, and they live within the community, both rural and urban. And so this engagement is another way of trying to also build a capacity so that they can also take this campaign forward. So please, I would, at this juncture, appeal that we try to draw the curtain on this discussion. You would not mind if I just quickly run through some of what has been said, because I just want to do a summary of what has been said, and also give room for the Deputy President of Nurses Across the Borders to give his vote of thanks. For all the speakers and the participants, we have a certificate of participation to give to all of you. For those speakers who are here today, we are going to symbolically give them their certificate. We're going to show it here on the screen, and you are going to please join us by unmuting yourself to clap for them. So when I call a particular speaker, I will screen share his or her own certificate of participation, and the best you can do for us is just to clap and appreciate them. But for everyone who registered for this event and participated, your names have been engraved in your certificate, which we will mail to you. We have taken records of those who actually took part. And I also want to understand that a lot of people could not have joined because of some technical issues. Having said that, I want to appreciate Mrs. Madeko Dumi for her insights into all that she has to try to link climate change to the current pandemic, COVID-19. And one major take home there is the fact that the climate change has brought about extreme weather, which to a larger extent is exacerbating the spread of COVID-19. There is this theory that yes, COVID-19 spreads more during the cold weather than in the hot weather, and that is why you have it has not been scientifically proven. But then it is something that yes, that we also know that yes, whether there is COVID-19 or not COVID-19, the excessive nature of anything is bad. When you have increased heat or increased cold, it is not good for the body. That is why God has made us in such a way that yes, that we should have homeostasis, whereby we have to balance both the internal environment and the external environment. Mr. Odinaka spoke on the social and health determinants, which increased, and he also was very clear as to the fact that the situations, the environment, or the change in the season is also increasing the spread of both airborne diseases and waterborne diseases, and which is very, very clear. By the time for the people who are in the rural area who do not have access to pipe-borne water, and they only use their means of source of water is through the stream. When you have excessive flooding and all that, all the stream polluted, all manners of rubbish are moved down there, and that is the only place they're going to have their source of water. And so this is also not a good thing, which we all have to work on. And to the registrar, Dr. Abubakar Umar Farouk, one major take from the paper is the proposal that all institutions should incorporate climate change as a course for every student. So not just higher institution. So it has to start from even from the primary school, teaching children this teaching them the best lifestyle as not to pollute the environment. And then they start from there, and then we're going to build it up and all that, because number one, what we're actually doing is to prepare a sustainable future for our children. Part of what we are starting from today is the handiwork of our forebears and some of us who are over today for quest of trying to make a living. We do not care as to how we make our money. So we have that as a takeaway from that. For Dr. Awe, we appreciate her for trying to underscore the vulnerability of women as a result of climate change. They are vulnerable in the sense that yes, when there is climate change, when there is excessive heat or there is excessive rainfall and others, there is a need for those in rural area to migrate from one particular place to the other. Even if they have to even go to the urban city, to be exposed is not the way that yes, none of them, because of the fact that yes, because of the limitation of their understanding of what is going around, a lot of people are about to take advantage of them, and they are also exposed to rape. So Dr. Sika, she spoke a lot about the role of the private sector. I think every one of us, if you don't mind me, we are, whether if you are not a government worker, you are in the private business. If you don't have to have a multinational company to be in private business. As the head of your home, you are not working for government. There are things you can also do that can help to also promote and that can support the investment in climate change, not by building industries. But one thing she said is that our way of life and business practices brought us to where we are today. And it is that same way of life, our business practices, that will also pick us up. What does that mean? There should be a reorientation of how we do things. And so we must have a change in the way we do our stuff. And finally, I will want to also recognize the contribution by our partners, first by the president of the Nigerian Charitable Association, the UK, Princess Wendy Olayiwola, and the testimony she shared with trying to introduce we try to introduce clean energy into health provisions, and the baby that was delivered, applying this method. These are innovations. But now, because we are all part of this meeting with this information has been shared, so these are things that can be replicated by governments. So these are the roles that we have to play as pressure group to our government back home. It's not enough for our leaders to come to UK or America to receive medical treatment, but whereas we have the funding to provide the best hospitals that money can buy in our countries. And so these are some of the things, and I also thank the SSA to the governor. So having said that, ladies and gentlemen, I will want to, before calling on Mr. Honorable Shegun Aditola to give the vote of thanks, I will want to crave your indulgence to please provide for our speakers today their certificate of participation into, for our event, as a way of as our way of trying to thank them for all that they have done. You just give me 1 second. Let me just bring out this document, and then I'm going to start with Mrs. Tenny Mrs. Tenny Majekudumi. Is everybody seeing my screen?
Yes.
We can see it.
Okay. All right. That is from Mrs. Tenny Majekudumi, and that is from Nurses Across the Borders and partners. As our own way of telling you thank you. If you don't mind, if everybody can just unmute and just let's clap for Madam Tenny for her presentation and her participation. Please just unmute yourself and just let's just thank her.
Thank you very much.
Thank you very much. I want to bring up for
Madam Nina, please mute yourself. Thank you. Pastor Peter, please go ahead. Okay, I guess at some point we lost him. Okay, yeah, okay.
While the meeting was going on, let me quickly recognize the presence of Abdurafiu Adeniji, the immediate past national president for the Nigerian Nurses, for the National Association of Nigerian Nurses and Midwives in Nigeria. Alaji Abdurafiu Adeniji, MNI. You're welcome, sir, for joining us. Thank you.
Thank you so much.
If Mr. Adetola, okay, thank you very much, sir. Let me call on our international youth coordinator, Nelson, to give the vote of thanks, since Mr. Adetola is not here at the moment. So Nelson, please give the vote of thanks while I sort out the issue of the certificate for others. Thank you very much. Nelson. Hello. Okay. All right. Gino, are you still there? Gino. What's happening? Everybody's muted. Gino, can you all hear me? I don't know if...
Yes.
We can hear you.
Yeah, I can
hear you.
What's happening to this? Okay. All right. Let's have Madam Amaka Eze to do the vote of thanks while I sort out this. Madam Amaka, please, you could you have the floor. Is Amaka here, please? She's muted. Madam Amaka, please, we are waiting for you to speak. All right, John.
Okay, while you are trying to sort that out, technology happens. Even Facebook had a glitch. Lately, we've had people who MTN went down service. So, generally speaking, thank you. Good to see that our session has generated lots of thinking and energy in both the audience and the participants. With these last remarks, we are ready to close the session, and thanks to all our speakers who shared their insight with us today. And thank you, yes, you who is in the audience for contributing your comments. There are still some questions that have been shared, and we invite you to continue to spread the word about that you have heard today. And we are hoping that the government of Nigeria, through the Ministry of Health, the Ministry of Environment, the Senate Committee Chair on Climate Change and Ecological Fund, the partners that joined in, the speakers and the participants, everybody who join hands to make our world. Don't forget, this is our home right now. If we don't keep it, we won't have a home to call our own. So we need to continue our collective, individual and collective action to make sure that climate change action is real, and we should take as little steps. There is a step you can take to improve the climate situation in Nigeria. And don't forget, this is a pre-COP26, and we are hoping that during the side event, some of the recommendations will be shared during the event, and some of your questions too would probably receive answers as at then. And thank you very much for the opportunity to facilitate and co-moderate this event. And thank you to our chief host and the supporting partners. We really appreciate our speakers. Thank you, and hope to continue the conversation and the action. Climate action is our action, and we'll continue to do this. Thank you on behalf of Nurses Across the Borders, Humanitarian International. Thank you very much for joining in, and thank you for the event this evening. Pastor Peter, please, the floor is yours.
Thank you.
Yeah, I think we're on. Now, shall we just appreciate Dr. Awe Olufumilayo? So our certificate of participation is there. Please, can you just please unmute yourself, and please just let's clap for Dr. Awe. Please clap for her. Thank you, Dr. Awe. That is your certificate of participation. We definitely are happy that you are part of this. Yes. Now we move on to our next.
This is our sticker. This is how our certificate is going to look like.
Thank you. Thank you very much. Thank you very much. I have to run now. Thank you.
I know you want to go, so we are sharing your certificate now.
Thank you, everyone. I hope to see you at Glasgow.
All right, Dr. Osika, that is yours. That is yours on the screen. Thank you very much. Thank you very much. Thank you very much.
Thank you, Pastor Pete. I hope to see you guys in Nigeria, in Glasgow very soon.
Do you accept it from us?
Yes, I accept. Thank you very much. Thank you.
All right, thank you very much.
Thank you. Bye-bye. Thank you.
All right, bye-bye.
See you in Glasgow.
Yeah, see you 2 weeks in Glasgow. Now let me for Princess Olayinwola, please just let me just give her ours right now. Yeah. Okay, stop sharing.
I have a glass gone.
Sorry. 1 second. For Dr. Awe. Okay, we've done Awe. Okay, yes, we've done Awe. Now for Wendy. Shall we just give out? Shall we just you know, Wendy, Doctor. Are we seeing Wendy on the screen? No.
No.
Okay, 1 second. As is here. Okay, no, Wendy. Is it on the screen now? No.
No.
Don't do this to me. Okay, I know what to do.
Wendy's on the screen now.
Wendy's on the screen, right?
It's not on the screen.
Not
Not on the screen.
Okay.
Hang on. See, it's, I think is coming up. Okay, Princess Wendy Olayola, shall we just please give her a round clap? Just thank you. Thank you very much, madam. Let's give it to Mr. Odinaka.
They say we should clap. As you're calling your name. Yes, we've done the killing now. Where is my your name?
Ambassador.
They are giving now back to small. The kidney is low. Cannot hear you. Yeah, they can hear you. I have muted Marlon.
No, we can hear you.
Remember.
What is the okay with Abdurrahim Alaji. Okay, Alaji.
They cannot hear me. They say we can hear you.
For Dr. Abubakar Umar Farouk, the registrar. Are we seeing him now? Okay.
I'm still there.
Yeah, that's for Alaji Dr. Abubakar
Umar Farouk.
Umar Farouk. That is the registrar of the Northern Military Council. So shall we just please
thank you.
give him? Thank you very much, madam. Thank you very much, madam.
Thank you,
very much. So all this will be sent down to your mailboxes, and then so you can print out and then you can engrave. So let me the other speakers now. What am I missing out now? Odinaka, Ambassador. Sure. What is happening now? Dr. Lynn Wilson. Let's just that is for Dr. Lynn Wilson.
Will you go back inside first?
Okay, that's for Dr. Lee Wilson. Let's just clap for Dr. Lee Wilson. Thank you very much for her time, and she actually shared her time with us. We also want to appreciate you guys are gonna give me. You're gonna. This is Larry. Now for Princess, we don't Princess Senator Mohamed Gassau, Akugono, Dr. Abubakar Farouk, yes, Dr. Awe, Dr. Morenike Oko, Lynn Odinaka. Okay. All right. Let me share the screen for Odinaka. Please for Odinaka, please. Ambassador Odinaka, quickly. Please, I want to just appreciate him. Thank you very much for your time. Thank you very much. Thank you very much for your time. Thank you. Thank you. Yes, now let me, okay. Now Usika George is done. Mrs. Tenny has been done. Abdurrafiu, please join me as we appreciate the immediate past president of now, Alaji Abdurrafiu Adinidi, MNI, who took time to also join us. Thank you very much for your time, sir. Thank you very much. Now, I've been receiving text messages from Dr. Bola Ofi, who is the current chair of the board of Northern British Council. So she also has a certificate here. Mrs. Francis, no, Pastor, yes, let's appreciate the SSA to the governor, to the first lady of Osun State, Mr. Rotimi Ajayi. Thank you very much for your time and for representing the office of the first lady. Thank you very much. That's for him. So we're making progress. Yes. Yeah, Mr. Olaro Timmy is a partner all the way from the US, and I hope she's a lot. So please, let's just maybe to appreciate her with the type of let me just share her. So let's appreciate Mr. Olaro Timmy. He's a frontline community worker both in Nigeria and the United States of America. Thank you very much, madam. So now we go to, yeah. So I think, is anybody missing from today that I've not given among the speakers? No. So in all, I want to say that for those of us who took part, we've made certificates for everybody. So I am it will be sent to your mailboxes, but we just quickly recognize these speakers for their time and for their contribution. We didn't pay them any honorarium for the job they've done, but because of their love and their service to humanity, they voluntarily make their time available to support this cause, because climate change is not respected of any man or race. So it affects everyone, and so it requires collective efforts for us to achieve our purpose, to see how we could reduce the carbon emission and then keep the atmospheric temperature not above 1.5 degrees centigrade. So once again, on behalf of the Board of Trustees of Friends Across the Borders and our partners, NSCA UK, the Senate Committee on Ecology and Environment, SeaTrust Institute, Ikosi-Ejirin, Local Government Development Authority, Civil Society Network of Nigeria, and every one of you that are taking part in this, I want to say a big thank you and God bless you. We look forward to the next session, because it's going to be a continuous engagement going forward. And for those of us who will be in Glasgow, we all made it to continue this campaign. Once again, thank you all and God bless you.
Amen. Thank you.
All right. So
these people.
Thank you and bye.
Bye, everybody.
Bye, everyone.
Bye.
Bye, everybody.
For me, thank you, sir.
Very much.
Bye,
Thank you all. Thank you all. Thank you all.
Thank you. Thank you. Thank you.
Thank you, sir, for organizing such an amazing program.
Okay.
Thank you. Thank you.
Thank you, madam. Thank you. Thank you. You were there with us from the beginning to the end.
Yes, yes,
And
thank you.
I'm going to also share. I'm also going to share the papers presented by everybody. So to your email
Okay.
bosses. So
Oh,
Thank
please,
you. Thank you very much. Thank you.
Madam Owolabi, we appreciate you.
Thank you. Thank
you very
you.
Thank
Thank
you.
you. Thank you. Thank you.
Thank you, sir. Thank you. Thank you. Thank you.
Thank you.
Thank
Thank
you.
you. Thank you.
Suki.
Thank you.
Thank you all.
They are telling me thank you now, so I mean I should respond.
John.
Thank you. Yeah.
That's why I'm responding.
Mr. Sonny Olowosile, thank you for your time. Thank you, Helen. Thank you, Dr. Dorothy.
Me, I'm
Thank
faking
you very
what?
much for representing the registrar. We
I'm
appreciate
faking.
you. As we understood the network issues, and for Tenny Madekodumi, thank you. Ajayi, thank you. Gino
Thank you,
Obadeji,
Pastor.
thank you. The Amaka is a thank you and apology for the bad network. We'll meet, and then Henry, thank you for your time. Obi Ahams, thank you very much. Rukayat Agbola Bello, thank you very much. We appreciate you all. Thank you for your time. Thank you all. Thank you all. So it's our time I call it today. So I'll be calling this meeting to an end. Thank